Liver blood tests. Liver blood tests, also sometimes called liver function tests, are done to find out how well your liver is working. They involve measuring the levels of various substances, such as proteins and enzymes, in the blood. For the test, you will need to have blood taken. Some food and medication may influence the results, and you will need to check with your doctor beforehand to see what needs to be avoided prior to the test. The test looks at a number of indicators to diagnose liver issues such as infection, inflammation, or a blockage in the bile ducts. It also measures the liver's ability to produce a protein called albumin and blood clotting factors. The tests are also done to detect signs of liver disease. Other blood tests that seem unrelated to your liver may be requested at the same time. For example, a complete blood count. The blood samples are sent to the lab for analysis, and it can take a few hours for the results to be processed. An abnormal result doesn't necessarily indicate liver disease, and sometimes additional tests will be required. The test may also be used to monitor the progression of a disease or to monitor the possible side effects of medication. So the blood sample is analyzed to look for any abnormal levels in the enzymes, proteins, and other substances produced by the liver. Alanine transaminase, or ALT, is raised when the liver cells are damaged or inflamed. Aspartate transaminase is raised when cells are damaged or inflamed, but AST is not specific to cells in the liver. Alkaline phosphatase is raised when there is a blockage, such as gallstones within the bile ducts. Albumin and total protein. Low levels of albumin or total protein mean that your liver is not working properly and could indicate liver failure. Malnutrition can also cause a lower level of albumin. Bilirubin. High levels of bilirubin can indicate that there is an obstruction of the bile ducts in your liver or in your gallbladder. It may also indicate liver damage due to inflammation. Gamma-glutamyl transferase, raised when there is damage to your liver. It can also be raised by chronic excess alcohol consumption. L-lactate dehydrogenase is released when cells anywhere in the body are damaged or break down. It can be raised in many conditions such as liver disease, as well as limb injury or hemolytic anemia. Prothrombin time measures how quickly your blood clots. A high prothrombin time means that your liver is not adequately producing clotting chemicals and is a sign of liver disease. Medications such as warfarin can also affect this. Thank you for your attention.
Let's now go to pathology of yin-yang imbalance. Let's discuss yin excess and yin deficiency. The excess of yin denotes the excess of yin pathogenic factors such as cold. In a broad sense, it may include also dampness and phlegm, as these pathogenic factors often originate from a deficiency of yang, although it should be stressed that both dampness and phlegm often associate with heat. There are basically four types of excess of yin. First, it can be an external yin pathogenic factor such as wind cold or cold dampness. Second, it can be external cold that invades the interior of the body directly without going through an exterior stage. This happens in the stomach, intestines, and uterus. Third, it can be external cold that invades the channels and joints, causing painful obstruction syndrome. And fourth, it can be internally generated dampness or phlegm. Although these two pathogenic factors generally derive from a yang deficiency, dampness and phlegm in themselves are yin. Pathogenic factors and the type of excess yin in this case. Therefore, there is a simultaneous excess of yin and deficiency of yang. Please note that even when they are combined with heat, dampness and phlegm are still yin pathogenic factors because they are an accumulation of pathological fluids. The clinical manifestations of excess of yin will involve cold symptoms such as feeling cold, cold limbs, pain, pale urine, etc. And the organs that are most affected by excess of yin are the stomach, lungs, intestines, and uterus. You can see here the types of excess of yin, the external yin pathogenic factor, like when cold, external cold invading the interior of the body directly, external cold invading the channels and joints, and internally generated dampness or phlegm all leads to excess of yin. The deficiency of yin involves the excessive consumption of the body fluids, the yin substances of each organ, the essence, and the blood. The main cause of yin deficiency in Western patients is overwork. Yin deficiency usually develops very gradually and slowly over several years. The only exception to this is the yin deficiency that can develop rapidly in febrile diseases when pathological heat consumes body fluids and yin. The clinical manifestations of yin deficiency involve dryness, such as a dry mouth in the afternoon, dry skin, dry eyes, etc. If yin deficiency persists for a long time, it eventually leads to the development of empty heat. The clinical manifestations will therefore involve heat, such as a feeling of heat in the afternoon, a dry mouth with desire to drink in small sips. It is important to note that although yin deficiency eventually causes empty heat, it may exist for years without generating empty heat. The tongue reflects these situations very accurately. Deficiency of yin manifests on the tongue with a lack of coating, that is, a tongue without coating but of a normal color indicates yin deficiency without empty heat. A red tongue without coating indicates yin deficiency with empty heat. The organs that are most subject to yin deficiency are the heart, lungs, kidney, liver, and the stomach. Thank you for your attention.
Let's have Food Yangming Stomach Meridian Stomach 32 Food 2 Prostate Hair. Stomach 32 Food 2 Crouching Rabbit on the anterior thigh region, 6 tune proximal to the superolateral angle of the patella on the line connecting the axis and the superolateral patella. The point can also be found by dividing into thirds the distance between the prominence of the greater trochanter and the superolateral patella. Stomach 32 occurs just superior to the junction of the lower and middle thirds. Stomach 32 earned the name crouching rabbit for the bulge that appears in the living individual who is actively contracting the vastus lateralis muscle. The prominence in this bulge resembles the kyphotic spinal curvature of the rabbit crouching, while the Chinese name Fu Tu for stomach 32 means crouching rabbit. Fu Tu for Li18 means support the prominence. Stomach 32, Fu Tu, prostate hair, hidden rabbit, prostate rabbit, crouching rabbit, out heel, outer hook, a point of the pattern which used to release the 7 internal dragons. Removes obstruction from the channel and has similar effect to stomach 31. Although not as effective for raising the leg, but promotes circulation in leg and knee, and used for pain and cold in the lower back. Expels wind heat when it affects the blood. So useful in certain skin diseases characterized by wind heat in the blood, such as acute urticaria. Indications: spasm and pain in the hip area and lateral aspect of the legs, urticaria, or acute wind heat in the blood. Similar in effect to stomach 31, it promotes circulation in the lower limbs. The name derives from its anatomical location in an area which resembles a crouching hare with its ears lying along its back. Although principally used for channel disorders of the lower limb, the sage-like prescription from the typing era recommends food to stomach 32 for diseases of the 8 regions in women. These are in the external genitalia, the breast, disorders of pregnancy, postpartum disorders, uterine bleeding, leukorrhea, menstruation, and abdominal masses. Indications and potential points combinations. Pelvic somatic pain, anterior iliac region, stomach 32, palpate for myofascial, trigger point, contributors to palpatory tenderness. In addition to the vastus lateralis muscle, GB 26, GB 27, GB 28, and GB 29, stomach 36. Pain, weakness, or paralysis of the legs or the pelvic limbs related to the femoral nerve distribution or mid-lumbar spinal segmental dysfunctions, stomach 32, stomach 36, bathroom, web spaces between the toes, bladder 23, bladder 24, bladder 25, GV3, and GV4. Thank you for your attention.
Let's now go to lung patterns. Let's discuss when cold invading the lung. The concept of when cold pathogen invading the Weiqi level of the lung system and impairing the lung dispersing function. In analysis, this pattern is mainly caused by the exterior wind cold pathogen invading the Weiqi level of the lung system and impairing the lung's dispersing function. The key symptoms would be cough, clear, watery sputum, along with symptoms of an exterior wind cold pattern. The clinical manifestations would be cough, clear, watery sputum, aversion to cold with slight fever, stuffy nose with clear, watery mucus, absence of sweating, head and body pain, thin white coating, and a floating and tight pulse. Here, the analysis of wind cold invading the lung when there is lung qi when lung qi becomes congealed, failing to diffuse, uh, causing lung qi counterflowing upward, there would be cough. If fluids in the lung collect to form phlegm, there would be clear watery sputum. If it affects the lung orifice, there would be stuffy nose with clear watery discharge. When the exterior Weiqi is hindered, causing failure to warm the skin, there would be slight aversion to wind and cold. If the Weiqi is hindered, there would be fever. If the cold pathogen resides in the channel and obstructs the flow of qi, then there would be head and body pain. If the cold pathogen contracts and obstructs those sweat pores, there would be no sweating. Also, if there's thin white tongue coating and the floating and tight pulse are manifestations of wind cold invading the lung. The wind cold invading the lung etiology, exposure to exterior wind and cold, relative weakness of the body's qi in relation to the pathogenic factor. Signs and symptoms would be aversion to cold, fever, cough, itchy throat, slight breathlessness, stuffed or runny nose with clear watery discharge, sneezing, occipital headache, body aches, absence of sweating, heavy voice, itchy throat, cough, and absence of thirst. The pulse would be floating and tight. The tongue would have a thin white coating. The treatment principle would be to dissipate when cold, diffuse the lung, and suppress cough. In acupuncture treatment, we can use lung 7, which releases the exterior and expels wind, gallbladder 20, expels wind. DO16 expels wind. Bladder 12 for cupping, which expels wind and releases the exterior. Sangel 5, which expels winds and benefits head. Li4 releases the exterior. Bladder 13 suppresses cough and regulates lung qi. It is also advisable to do needle with drainage for headache, add DO20 and Si3. For absence of sweating, add kidney 7. For nasal congestion and running nose, add Li20 and extra point yin tang. For cold, for cough, add bladder 13 and bladder 11. For relevant advice, when there are invasions of wind cold, it is advisable to consume beverages that are hot and spicy to open the exterior and expel pathogenic qi. This could be, for example, ginger, garlic, whiskey, brandy, or chili. Fasting is also advisable for only eating soup, such as onion soup. There are two reasons for this. First, when temporarily fasting, qi will not be used to transform food and therefore can be used to combat the invading pathogenic qi. Second, some sources say that the downward movement of food and qi in the stomach can draw the exogenous pathogenic qi inwards from the surface. Similarly, the sour flavor should be avoided due to its astringent and centripetal dynamic. Vitamin C, lemon, and other things that are very sour should not be consumed during an invasion of exogenous pathogenic cold, as they will withdraw the pathogenic cold inwards whilst closing the pores in the skin, thereby preventing the cold from being expelled again. This also means that antibiotics are not recommended at this stage as they are cold and drain downward. Thank you for your attention.
We go to diagnosis by Qi and blood. Let's continue the Qi syndromes. Abnormal Qi movement. Abnormal Qi ascent refers to disturbance of Qi movement so that Qi ascends when it normally descends. Clinically, this mostly affects lung, stomach, and liver Qi. Pathology. Abnormal ascent of lung Qi is mostly due to exogenous pathogenic evils attacking the lung. Turbid phlegm accumulating in the lung or the lung losing its function or of depuration. Abnormal ascent of stomach Qi is mostly due to exogenous pathogenic evils attacking the stomach. Retention of food, accumulation of cold rheum or turbid phlegm in the stomach. Abnormal ascent of liver Qi is mostly due to liver injury by pent-up rage, hyperactive liver Qi, or abnormal ascent of Qi fire. Clinical manifestations. The typical syndrome of abnormal lung Qi ascent includes coughing and labored breathing. The typical syndrome of abnormal stomach Qi ascent includes hiccup, eructation, nausea, and vomiting. The typical syndrome of abnormal liver Qi ascent includes dizziness and distending headache. Sometimes there may be syncope or hematemesis. Qi stagnation. Syndrome of Qi stagnation develops when there is a blockage of movement of the Qi of a part of the body or an organ. Pathology. Suppression of the passions, dietary indiscretion, exogenous pathogenic evils, phlegm accumulation, and blood stasis can all impede and block Qi movement and lead to syndrome of Qi stagnation. Clinical manifestations. The typical syndrome of Qi stagnation includes distension and pain in the chest, epigastrium, and abdomen. The pain tends to be migratory and fluctuating. It is often alleviated by eructation or farting, but aggravated by frustration of the passions. Thank you for your attention.
Subjective data, 1 of 6. Patient identifiers and chief complaint. The provider should first document patient identifiers, including the patient's name, date of birth, and the date and time of examination. This is followed by the chief complaint. The chief complaint must be expressed in patient's own words and is written in quotation marks. For example, if a patient presents to a clinic with a chief complaint of abdominal pain and expresses it as, "My stomach is killing me," then the phrase, quote unquote, my stomach is killing me, is documented in the chief complaint. Documenting the patient's chief complaint in his or her own words serves to highlight the patient's reason for presenting to the healthcare facility. History of present illness. Along with the chief complaint, the history of present illness is documented. The HPI is a concise description of the patient's recent history. The opening sentence should contain key pertinent data that both the provider and any other healthcare professional should know, including age, gender, and significant comorbidities. For example, if the patient presents with a chief complaint of a lump in her breast and is 10 weeks pregnant, the opening sentence of the history of present illness should state a 26-year-old female who is 10 weeks pregnant presents with a recent history of a lump in the upper outer quadrant of her left breast. This information alerts the provider and all other healthcare workers that the patient is pregnant, a key factor that must be considered when developing the patient's treatment plan. If, in fact, this patient has breast cancer, then the typical treatment guidelines for breast cancer will need to be altered. The patient will not be a candidate for any treatment or medication that would be harmful to the fetus. Failure to document its information would have significant legal implications. Once the opening sentence is developed, the clinician then documents the patient's presenting signs and symptoms. For each sign or symptom, the clinician should fully explore each topic by asking pertinent questions using the mnemonic PQRST or client outcomes. These are important factors that guide this patient's plan of care and help to identify future teaching needs. If a patient describes more than one sign or symptom, each one should be explored. For example, if the patient states that she has a severe headache as well as nausea and vomiting, each component needs to be described or explored in depth. The clinician never wants to make the assumption that the signs and symptoms are related. The headache may be a long-term problem that the patient always has, but the nausea and vomiting may be a new onset. For situations in which the patient has an extensive recent history, such as a trauma patient admitted into the hospital, the key pertinent data are summarized in the history of present illness. So all healthcare providers who are involved in the patient's care understand what has happened to the patient and what treatment modalities have already been implemented. All recent diagnostic tests, along with the outcome of any intervention taken during this recent hospitalization, should be summarized. For example, if a patient is intubated in the emergency room, the practitioner should record whether the initial intubation effort was successful, what size tube was inserted, where the ET tube markings are in relationship to the patient's lips, and what was suctioned from the lungs. If it was a traumatic intubation, this should be documented in an effort to alert other healthcare workers that the patient may have bloody oral secretions as well as hemoptysis. It also alerts others that the patient may develop laryngeal edema upon extubation. Thank you for your attention. Acupuncture for Emergencies, Drowning, Part 2. With modern techniques, for those who have been drowning for more than 25 minutes, the death rate is 100%. According to Chinese medicine, even if the person is dead for up to 24 hours, due to drowning, the life can still be saved. Upon acupuncture on REN1, if stool or urine comes out, it suggests that the person can be saved. The REN1 can be stabbed with a triangle-edged needle. Cover the needle tip with a thin layer of soap before use. If the person usually has constipation, it is not easy to allow the stool to come out. In this case, insert a piece of soap in and out of the anus several times to stimulate the stool to come out. In most cases, drowning happens suddenly and it is outdoors, but a lifeguard working at a swimming pool or beach should be able to keep the herbal powder on hand in case it is needed. Any of the regularly used moxibustion treatments can be used, such as direct moxie or indirect moxie, with fresh ginger over the acupuncture points on REN6, 4, and UB23. This can speed up first aid. Warm up the chest first. For example, use a hot water bag folded with several layers of towel. Do not warm up the body by letting it directly face a fire. The success rate is higher in summer than in winter. It has been indicated in Chinese literature from history that the Chinese ways can save the life of a drowned person who has lost heartbeat and has stopped breathing for more than 24 hours. The Chinese way of saving a life from drowning introduced here could be a very big question and unbelievable from a conventional medicine point of view. It is recommended that the doctor can still use the conventional medicine ways first. If the person has been declared to be dead after trying the conventional ways, why not try the Chinese way also? Thank you for your attention. Fibromyalgia, the muscle channels. The muscle channels are discussed in Chapter 13 of the Spiritual Axis and are called Qing, which could be translated as channel-like muscles or muscles of the channels. Indeed, the muscle channels are essentially the skeletal muscles of the body as seen in ancient Chinese medicine, and therefore the term channel-like muscles rather than muscle channels would be a more accurate translation of their name. However, the muscle channels are much more than just the muscles of Western medicine because they form an integral part of the channel system and perform specific important functions in the circulation of qi and blood and in the adaptation of the body to the external environment. The muscle channels have 6 main characteristics. They are on the surface of the body, they do not connect with the internal organs, they all originate at the extremities, they broadly follow the course of the main channels, they follow the contours of the major muscles overlying the main channels, they are grouped into 4 groups of 3 channels, each of the same polarity, yin or yang, and same potential of energy, leg or arm. The muscle channels are on the surface of the body, and they are therefore part of what is called the exterior of the body, as opposed to the interior of the body that is constituted by the internal organs. However, the muscle channels constitute part of the exterior of the body in a different sense than for the connecting channels. The connecting channels constitute the exterior of the body more in an energetic sense than a physical one. They are the superficial channels running in all directions that are between the main channels and the skin. It is through them that pathogenic factors penetrate the body initially and the channels where the defensive qi circulates. Because they are directly connected to the main channels, the connecting channels form the main route by which pathogenic factors may penetrate those main channels. The connecting channels also run in the space between the skin and muscles, a description that again should be understood more in an energetic than an anatomical sense. Therefore, in this context, the muscles, as in the space between the skin and muscles, are not the same muscles as in the muscle channels. The muscles are, as in the space between skin and muscles, signify primarily an energetic layer and indicate a certain energetic depth. That is one that is between the energetic layers of skin and sinews. The muscles, as in muscle channels, are the actual skeletal muscles, some of which are next to the skin and some of which are deeper. By contrast to the connecting channels, the muscle channels are part of the exterior of the body more in an anatomical than an energetic sense. Muscle channels are also easily invaded by external pathogenic factors. However, such invasions manifest primarily with muscular symptoms such as ache, pain, or stiffness without the general symptoms of invasion of the defensive qi portion, aversion to cold, fever, sore throat, etc., which occur when the connecting channels are invaded. The symptoms of fibromyalgia are a good example of invasion of the muscle channels without symptoms of external invasion. The pathology of the muscle channels involves 2 basic conditions of fullness or emptiness. Fullness manifests with pain, contracture, stiffness, and hardness. Emptiness manifests with slackness, flaccidity, and a dull ache. Tingling may be due to full conditions, such as phlegm in the muscles, or to empty conditions, such as deficiency of blood. In fibromyalgia, the muscle channels are involved with symptoms of muscle ache that may be due to dampness, wind, cold, chi stagnation, or blood stasis. Thank you for your attention.